Okay.
Okay. Welcome, everyone. First item on the agenda is approval of the agenda. Is there a motion to approve the agenda as? We have a motion. Is there a second, Mike? Okay. All in favor, say aye. Aye. Any opposed? Okay. Approval of the prior minutes.
Motion to approve.
All, is there a second? All in favor of approving the prior meeting minutes, say aye.
Aye.
Any opposed? Okay, they pass unanimously. All right, Ridgefield, Ryan?
Amazing. We were there last night. We're the last ones to go. You know, we've staged this, different departments and force of people at Biltmore. And I haven't been over there for a while, and I would be really impressed with how it's very professional. Very professional. I guess that's the best way to put it. Just the kind of place you'd be proud to work at. Very good use of technology. It's just, you know, it's modern and well done. Just right, I think. I think you'll like the board. I don't know. Let's keep you in suspense.
Next meeting?
I don't get the one after that.
Yeah, I just.
Well,
You know, the furniture in
The,
there.
the conference room furniture may not be here
Probably.
until mid-April. So
It'll
May.
be close.
We're not gonna have any more problems with people not being able to hear when the HVAC fans go on and, you know, they're too far away or all of that. Very good setup for, I mean, Jerry, we might as well just give you the feed from the cameras we got there. I mean, you,
Cool.
why bother, right?
Oh, no,
We just
no,
download to you.
no, I capture what you don't do.
Oh. Yeah, what I don't.
Well said.
Really, that gives me
Well
something to worry
said.
about. We've got actually 2 cameras in there and, you know, nice dais set up, control panel, and offices are nice, just nice. And of course, the other side of this is they'll get right moving with renovations. 356. For all I know, they started on the bottom floor, and the sounds of it, they're about ready to. I mean, they're not wasting any time. Not wasting any time at all, and they want to have, you know, one part of the service going by July 1st, right? Is that still?
It's still the plan, that RHA's outpatient psychiatric management, instead like the ACT team, that they, up in that first floor where we are, came right into the top of the building where we are. That should be operational by July 1st, if everything goes as planned.
So how do you get to Ridgefield?
Well, you know when you go down the highway there and you see the sign for the outlet mall?
This is on 26?
Yeah.
First
Right
exit,
on.
26.
First exit on 26, and you come
So
up there.
right.
And you're gonna get off the ramp and you go to the left.
Past Bar.
Well, if you're coming from Asheville, okay? Coming from Asheville going south, it's the first exit.
191.
Yeah, is that at 191, you know, and it just loops you right up to Brevard. Is that what it's called there?
It's right there in front of Ethan Allen.
Yeah, and you just go to the left, you go down the hill, and Comfort Inn or Comfort Suites.
Between Comfort Suites and Ryan Steakhouse on your left.
And there's a whole slew of, it's like an office park back there.
We're the first piece of that 200 on the left.
Yeah, we're the first one on the left. There's others on the right, but we're the first on the left. Very nice. So, we're getting, you know, really great media coverage on C3 at 356. Great, a lot of recognition from our state partners. And I saw everybody coming out of the building yesterday. I guess they had a meeting, so you know, this is full tilt. So, I can tell you.
This, next item, legislative
Yeah.
update.
For the, yeah. I spent 4 days up in Raleigh. I know, it's like a month. Things are really heating up. Really heating up. A lot of interest in Medicaid reform, of course. Being positively viewed. All indications of the people that I met with, and I would say probably, it sounds terrible to say, and at one point, when I was with Rick, our government relations contractor, I thought to myself, I should be writing down all the people I'm meeting with. Probably 15. More notables were Tommy Tucker, Ralph Heiss, Danny Lambert, and Brent Jackson. By the way, he's the largest watermelon and maybe cantaloupe tree farmer in the southeast.
Good to know.
There's a nice pair of cowboy boots.
You say he's the largest producer, he's the largest.
No, largest producer, his farm. These are the gentlemen who are taking a very active role in the negotiations and, representing both the Senate and the House on Medicaid reform.
Okay. One thing I'll mention, Charles is aware of it, is the Senate is discussing changing, that's an understatement, the sales tax. Sales tax is distributed, basically taking it from local to make it a state sales tax, all sales tax state. And the numbers are good for a lot of counties, but it's, I think you gotta read the fine print. When it comes to state revenue, then it can be used to balance the state budget, just like the lottery funds were or other things. So I think both the Association of County Commissioners and the North Carolina League of Municipalities are opposed to it. There's a lot of stuff that's gotta be discussed, so, but it could have tremendous impact on all the counties and cities in North Carolina. So, stay tuned, Mike.
Stay tuned for that one, because it'll be definitely good.
Yeah. Now, of course, there's,
Schools too. It
yeah.
impacts schools too.
let's see, is the Senate deadline today for filing bills? I think it is.
Yes.
So, they've been flying in. So, it'll be an interesting time.
Sure. Okay, that leads right into the County Commissioner Mental Health Task Force.
Yeah. Well, Rick, maybe you should give the report. You were there for longer than I was, actually, as it worked out.
We had our second meeting, that was, March the 10th, I believe it was. And we had a number of the CEOs there, really sort of starting with, agenda for you, but just really bringing an update, trying to educate the folks that were there. We had a smaller crowd second meeting than we did the first meeting. Talking about all the basic things about, I guess the whole news about burgers and sort of the move away from that and just what LMEs, MCOs mean and just a number of things like that. Brian spoke and there were a lot of questions. I thought a very good discussion. We plan on meeting in April, and once the sale model is where our next meeting is.
The morning part, I had to leave for the afternoon, but in the morning, it was just as Rick said, kind of I guess the idea was to have it be more like a panel type of discussion, and each of us sort of chimed in at different times, and just trying to explain this stuff. And I think in fairness, there were, county representatives there, people like Rick that have, a lot of understanding and experience, and some that probably, didn't hear very much at all. So, you know, it's hard to kind of shoot for the lowest common denominator, I guess, in terms of explaining things. But, you know, give Ronnie a lot of credit. You know, this is his group that he's pulled together and authorized, I guess, to, and I don't know the overall agenda or the platform, but certainly there's a lot of work to do with this. And in the afternoon, it seemed, again, to see a little, I don't know, odd, maybe having Mark Potts come and talk about the role, I guess, the role of counties in relationship to sort of imminent mergers or something, which, I guess that worked out okay. Yeah. Explain to people what was what. I mean, you know, the law is the law. And again, it's another area where counties, you know, don't play a huge role in the way they used to. You know, as big a role as they used to. But, you know, maybe that's helpful, I suppose.
Yeah. Okay, CC&C.
Yeah. Well, there's the big CCNC, and then there's the local CCNC. And I'll start off with the big CCNC. And then really good conversation that Christina can lead about the overall initiatives that we're involved with and some very targeted efforts. And as a matter of fact, she spoke to Ray yesterday. A lot of pretty significant changes, I guess, in their kind of corporate office. Mike Lancaster, a guy who's been around a long time, worked for, let's see, he's the medical director for DMA, wasn't he? DMA?
Yeah.
Division director. And he'd been around a long time. Was a medical director of CCNC, was let go, and that raised a lot of eyebrows. I'm not sure everybody is completely understanding the factors involved with that. Maybe we never will. Renee Ellen Dobson's position and Mark Benton, their positions have changed somewhat. And it appears that they're interested in seeking business opportunities outside of North Carolina. They're putting maybe more emphasis on that, to change their corporate structure to reflect that. So, you know, the fact that they have financial problems is not a secret. Proposed changes to the HIE, Health Information Exchange, that they kind of ended up with by default. Well, I guess, you know, we're just, you know, going to continue to watch them as a statewide organization and see where they land in relationship to Medicaid reform. You know, what relationship they will have to our project. And, you know, I've spoken about that, and Mark, who's here today, I don't think really is any different around that here locally. But it's a little challenging sometimes to kind of leave that in the parking lot, and then, you know, we have all these things that we're doing locally that are very important and very positive. Christina, you could probably best talk about those.
So to just give a little bit of basic information, so the Community Care in North Carolina is a set of 14 networks across North Carolina. Within our 23 counties, we have 4 networks. Our largest one is a group called Access Care, and they cover 13 of our 23 counties. We have a Northwest CCNC that covers Wilkes County, but they have some other counties in the Center Point area. We have another one who just covers just Rutherford County. And then we have CCWNC, which has been present, it was the Legacy Western Highlands Network. So one thing that's been very confusing in the system, even though they've been around for a long time, they have a large group of staff. We've just received copies of their organizational charts for the networks, and they have staff that are called care managers. You know, our folks are called care coordinators. One of their primary roles, and the corporate CCNC pays a PMPM, they are paying a per member per month to 98% of the primary care offices in North Carolina. What that does, it allows the CCNC networks, the people that are in the ground, these men and women that are care managers, to go in and assist the primary care offices in a variety of reasons. They can provide consultation to help with billing and coding as people walk in with different health issues. One of the pieces that we are very involved in and trying to have a better relationship with is they have also dealt with a lot of the behavioral health, substance abuse, IDD individuals, of course, who go to primary care. So there's been a rub, and we meet every month, the 4 networks, the directors, myself, Rhonda, Dr. Martin, some of our provider network staff, and a couple of people depending on what the agenda is. And we have really just, I think, forced ourselves to get in a room and really understand each other's roles. And kind of like where Brian started, at the corporate level of CCNC and the system at large, it's complicated, it's political, and there are always, even when I worked at the state, there were always tensions within the system. At the local level, you have men and women who work with, you have our care coordinators who are really trying to deliver good quality care to the individual who's in the middle of the story. And so we have this, I think yesterday was our 5th meeting together. We've been meeting for 5 months as of yesterday. They've been talking about their processes. We've been talking about our processes. And yesterday, I will have to say, was probably one of the best meetings we've had together. Because what we saw yesterday was Rhonda Cox, that y'all know from us, and a guy named Peter, who is out of Wilkes County for CCNC, really dynamic guy. They have been working on a project, meeting outside the monthly meetings, and really trying to have a standardized referral. So if an individual who has a disability that we serve or are required to serve shows up in a primary care office, what do we want that doctor to know and do? Well, one thing that we've instituted, which I think is really important, and we agreed to do a lot more publicity about this. If you're a primary care physician, all you need to know is Smokey's 1-800 number. Our call center will take that call. You don't have to sign any form. You don't have to fax anything. You don't have to do it. The only thing you need to answer is when we say, do you have a release for consent? The person on the other end of that phone says, yes. We're going to do a very short conversation with you, and we're going to look into whatever county you are to get this person an assessment or get them referred. Even if we had a situation the other day, it was a crisis situation. They didn't know about mother crisis, and mother crisis went to the primary care office. So we are offering that really kind of through CCNC. We're going to do they've now invited us to, I looked at it this morning, they meet with the practice managers, these people who are over. If you go into a primary care office, there's somebody who's in charge of that office, some man or woman. And we're going to start meeting with them with CCNC to really begin to talk about Smokey and the value of our providers and what our providers can do or not do. So that's one thing that's really happening. Another thing is we looked yesterday at a joint forum for the first time in history that is Smokey and CCNC, that their care managers and our care coordinators could do to make a referral. Either we can make a referral to CCNC, or CCNC can make a referral to a Smokey care coordinator to get some assistance for somebody. So at the local level, and even though we've been meeting for 5 months, if I drove out here to Buncombe County or McDowell County, the care coordinators and the care managers from CCNC, they've been meeting for a long, long time. They all know each other. They staff cases together. Up in Boone, they do weekly meetings together. So the people on the ground who really support consumers and families have had a long-standing relationship at that level of the system. What we're trying to do is bring some standardization and to really, very painfully, ask the question, what is everybody's role in the new world? If this ACO, RCO happens, our definition of care coordination in our model is very robust. We always talk about it as a very much a Cadillac model. CCNC, I have to say, in appreciation for what they do locally, they do a lot of things we don't do. And I don't know, and I've said to Brian on many occasions, I don't know. I mean, are we really in charge of helping primary care physicians figure out coding and billing? I don't know. But, you know, some things like that, Tracy says, no. You know, so they provide a lot of technical assistance to people. So we are working on these relationships, and what we're trying to do is just kind of keep it separate. We'll see what the General Assembly ends up doing. We'll see what happens here in the Western region to move forward with our vision. And in the meantime, we are really beginning with care coordination and care managers. Really try to look, because if you put both care coordination and care management around an individual, you've got a lot of whole person care going on. You've got medical and behavioral health, or IDD, and primary care. One thing I will say is that, matter of fact, I was on a call this morning with some folks, and many times I always feel like I'm all the time promoting individuals and their families who have intellectual and developmental disabilities. And there's a whole cadre of physicians who have an interest in that population that I don't think sometimes we know a lot about. And I think our families and consumers don't always know that by any means, and really struggle for care in some places. So, you know, just trying to really push the system, because people have a tendency to talk mostly about mental health and substance abuse. And as Fred educates me every time I'm with him, where, you know, a lot of our money is and where the really high cost of some of these individuals are, is truly on that side of the system. So I'll stop there. So there are good things going on. I don't know if you have questions about that. But we're very committed. And we have now been, as of today, invited to the practice managers meetings. And we have to really think about this, Brian. And going in and really meeting with the people who are running some of the really large. And this is beyond the mission offices, primary care offices, and this is beyond MAHEC's offices. This really gets into their network across our 23 counties of primary care physicians' offices. And that was a turning point yesterday. What got us in that door was the service that Smokey is offering to make that appointment for you. It's just a call, right? We're averaging about 7. Well, we only had 7, but it's probably what people don't know.
Yeah.
So everybody really likes that we're going to do that, and that brings great value, and it's hassle-free, really. So, I don't know if there's other things. I mean, that's kind of a bit down in the weeds and the details, but it begins to create a system of medical, behavioral health, and IDD around the person at a very local level.
What everybody wants, what we want too. Challenge to figure out how to get there.
Any questions? More questions? Okay, our next item on our agenda is calling for a closed session pursuant to North Carolina General Statute 143-318-11A3 to prevent disclosure of information that is privileged or confidential pursuant to North Carolina General Statute 122C, 126.1, or not considered a public record within the meaning of Chapter 132 of the General Statutes. Do I have a motion for closed session?
So moved.
Is there a second? All in favor of going into closed session, say aye. Aye. Opposed? Okay, it's unanimous. Motion to adjourn.
So moved.
Is there a second?
Second.
All in favor, say aye.
Aye.
Any opposed? Okay, it's unanimous. Thank you, Jerry.